Hello, my name's Kevin Hall. I'd like to tell you about our approach to treating low back pain. Now, low back pain is a very common entity. It has lots of different causes. There are lots of structures in the lumbar spine and pelvis that can generate pain, and there are lots of ways of treating it. There are common treatment approaches include joint manipulation and mobilisation, soft tissue techniques, strengthening programs for the lumbo-pelvic muscles, postural rehabilitation, all valid approaches. The challenge with treating back pain is ensuring that we match the right treatment protocol to the right patient at the right time, to ensure that we don't just have a favourite treatment approach, but actually we're delivering a bespoke treatment strategy. Now, the way that we do that is through thorough and careful examination. So when you come for treatment at Kevin Hall Physiotherapy, we will start with an interview where we'll get a good grasp, an understanding of your problem, and then we'll perform a physical examination. Now, the physical examination is designed to identify things within your presentation that we know are linked with low back pain. So, for example, we know that trigger points in the muscles of the lumbo-pelvic region cause pain and respond well to treatment. We know that joint dysfunction of the lumbar spine or the sacroiliac joints can generate pain and can respond to treatment. We know that global stiffness can be a problem with low back pain. Postural problems can predispose to low back pain, whether this be working postures, postures at home, or sporting postures. We know that weakness of the lumbo-pelvic region and the lower limbs can cause low back pain, and we know that there are commonly movement dysfunctions that can predispose to pain. Now, there's another video in this section on movement dysfunction, which will give you a little bit more idea about what we mean by movement dysfunction. Now, if we can identify on a physical examination which factors are relevant to you, then we can design you a bespoke rehabilitation program, which will commonly include some form of manual therapy, whether that's treatment to trigger points, joint manipulation to the structures of the lumbar spinal pelvis, joint mobilisation, but will also commonly include exercises to improve control of the lumbo-pelvic region, so that in life you're not irritating the structures through poor control or weakness. It will almost certainly include a strengthening program and postural rehabilitation. And so in this way, if we can tick all of the boxes that can contribute to low back pain, we have a much better chance of ensuring that you have maximum recovery. One of the problems that I find with people who've had treatment in the past is that only a segment of this pie, as it were, has been addressed. If you don't address the whole pie, then we don't have the potential for complete recovery.